Welcome back. It was just shy of 2 years ago when the New York Times published this striking front page marking 100,000 American deaths from COVID, something the paper at the time called an incalculable loss. Today, President Biden is marking 1 million lives lost, writing in a news statement just out a few moments ago this: 1 million empty chairs around the dinner table, each an irreplaceable loss, each leaving behind a family, a community, and a nation forever changed because of this pandemic. Joining us now, physician and fellow at the Brookings Institution, Dr. Kavita Patel. She is an MSNBC medical contributor and a former Obama White House health policy director. Dr. Patel, thank you for being with us. Just moments ago, the president put out that rather somber statement. So let's start there. Just give us your broad thoughts on America hitting this tragic milestone, how far we've come in the pandemic, mistakes that we've made, where we go from here.
Yeah, Jonathan, it is not only sobering, but it's also even more humbling when you think we're not done with this yet. And we're having, of course, a record low in deaths. That's a good thing. But we still have about hundreds of deaths a day. And many of those are just largely preventable, could have been vaccinated, including boosters. So I think where we are today, we're standing in the face of increasing cases. We're dealing with, yet again, another variant, a sublineage, a kind of a daughter, if you will, of the original Omicron. And what we're trying to do is understand how we can kind of move forward. Masks are gone. People, Jonathan, you and I have spoken about how it feels like people really just want to live their lives, but we can't ignore the facts in front of us. And I think the 1 million deaths is just a milestone that you and I will remember where we were when we first heard about the 100,000. Then it was 500,000, and now 1 million. And I think this is kind of the moment in history books that we will stop and say, what could we have done better? To that point, Jonathan, we probably need to do more now to just secure our ability as a country to lead and also take care of our own country. We lack the funding to have the security of having vaccines available for the fall, when experts around the world predict that we will have more of a surge that is reminiscent of this past winter, past fall of years. So I do think that this is going to be a very important moment where leaders need to lead. And I think as citizens and as people who live in the United States, we also need to really agree and accept that this is not just about one of us, it's about all of us. The deaths remind us of that.
Right. Now, Dr. Patel, you're right. Deaths are lower than they've been, but cases are really rising, and hospitalizations have started to go up, too. I want to ask you this. It seems like, anecdotally, that people who got COVID and an Omicron variant, even just, say, 2 months or so ago, they're therefore thinking that they would have some immunities from that and be safe for a while, are getting it again. There's perhaps one of these subvariants. What are you seeing? What's the early data on the reinfection rate? How worried should people be that if they had COVID a couple months ago, but they might be susceptible again?
Yeah, two good pieces of data. First, that people who have had kind of that, as you refer to it accurately, the original Omicron, what we saw in kind of November, December, January, just this past year in the United States, that does give you some immunity. And we do think that it protects you against BA2 and possibly BA2.121, which is what's been kind of flourishing in the mid-Atlantic and the upper Northeast. However, we're watching data out of South Africa with BA4, BA5, which is already in the United States, but is in a higher degree in South Africa. And remember, they're always helpful in leading us. We are seeing some reinfections there, but Jonathan, we're not seeing that BA4 and BA5 kind of really outpacing the other BA2 kind of strains in the United States. And that means that for the majority of people, there is some of that protection from the original Omicron, but it's not going to last forever. I think the important point you're illustrating, reinfections happen, and I think they're more likely to happen as time goes on and we see more of these mutations and more of these variants, even if they're related to Omicron.
And Dr. Patel, one last quick one, just if you could briefly revisit something you said a second ago about experts fearful of a much more significant surge this fall or winter. Why is that? What are they seeing?
Yeah, so just briefly, this is based on not only modeling from around the world, but also just looking at the pace of the mutations. We didn't know what coronavirus would have in store for us and how quickly it would mutate. Would it be slow? Would it be fast? pretty darn fast. Think about the original Wuhan strain just from 2 years ago, Jonathan, and where we are today. So based on that and weather and patterns, we're looking at more cases for the fall. And of course, it has to do with our decreasing immunity, which is why we need to have funding and preparation ready for fall vaccines, which looks very likely.
This is all extraordinarily informative. We greatly appreciate it. Dr. Kavita Patel, please come back soon.